Hi, this is Dr. A with your anatomy and physiology review of the senses. We're going to look at the ears. Alright, the function of the ear is it contains sensory receptors for hearing and for equilibrium, which is balance. And then the structures of the ear are the auricle, which is what you think of with the ear, the external ear, the middle ear, and the inner ear. So otology is the study of the ear, and audiology is the study of hearing disorders. So audiology is hearing, right? The ear is responsible for two senses, hearing and equilibrium, which is the body sense of balance. The sensory information is carried from the ear to the brain by the vestibulocochlear nerve. And the cochlear portion carries hearing information, and the vestibular portion carries equilibrium information. So let's start with the external ear. The external ear consists of the auricle, which is the part of the ear that you think of when you think of the ear, the auditory canal, and the tympanic membrane. The auricle or pinna functions like a funnel, and it captures sound waves and directs them through the external auditory meatus into the auditory canal. All glands within the auditory canal produce cerumen, which is earwax, which removes dirt and dust as it slowly flows out of the ear. The tympanic membrane, or the eardrum, lies at the end of the auditory canal and vibrates when sound waves strike it. The tympanic membrane also separates the external ear from the middle ear. Then we have the middle ear, and it is located in a small air-filled cavity in the temporal bone of the skull. This cavity contains three tiny bones that are called ossicles. There's the malleus, the incus, and the stapes. The vibrations amplify as they pass from the tympanic membrane to the malleus, then to the incus, and then to the stapes. The stapes transmits those vibrations to the oval window, which covers the opening to the inner ear. So if you can imagine, there are sound waves that are coming down this auditory canal, and they vibrate the tympanic membrane. As they vibrate the tympanic membrane, they vibrate the malleus, and as the malleus moves, it moves the incus, and as the incus moves, it moves the stapes, and it pushes it like that, and then the stapes is pushing on the oval window, creating waves in the fluid behind the oval window. The Eustachian tube is also called the auditory tube, connects the nasopharynx with the middle ear. So your middle ear is connected to your throat. This tube opens with each swallow to equalize the pressures between the middle ear cavity and the atmosphere. And if you have trouble with congestion and things, this tube can get like closed up, and then when you fly, especially when you land, this has caused uneven pressure between the middle ear and the atmospheric pressure, and it can cause pain in the tympanic membrane and stuff. Also, when children have surgery to insert ear tubes, if they have chronic middle ear infections, they're putting that tube into Eustachian tube. So here it is, all illustrated. So we have our pinna as part of the auricle, the external auditory meatus, the auditory canal, where sound waves travel and hit the tympanic membrane, which vibrates the malleus, the incus, and the stapes, which vibrates the oval window, which will vibrate the fluid here in the cochlear parts of the inner ear. And then here's the vestibular part of the inner ear, which does balance. And then here is this Eustachian tube here that connects and drains the middle ear into the throat. And so sometimes bacteria can come from the throat and travel up the Eustachian tube and cause infections in the middle ear. So the inner ear is also located in a cavity in the temporal bone. This fluid-filled cavity is called a labyrinth because of its shape. The first structure of the inner ear is the vestibule, which connects to each of the remaining inner ear structures. The cochlea is a sensory organ for hearing, and then the semicircular canals, utricle, and saccule are the sensory organs for equilibrium or balance. all these organs contain hair cells, which are the ear's actual sensory receptors. And so the hair cells are used for hearing, but they're also used for balance in different ways. And the hair cells within the cochlea are collectively called the organ of Corti. So here is, again, the middle ear illustrated with the tympanic membrane, the malleus, incus, and stapes, with the ligaments that hold them in place, and the stapes against the oval window. And then this part is the inner ear, and then if we go at the internal ear, so we have the vestibular duct, vestibule here, but this part is the cochlea and organ of Corti here with the hair cells, and then we have the utricle, saccule, and the semicircular ducts here, all used for balance. So how do we hear? Sound waves travel down the external auditory canal and strike the tympanic membrane. The tympanic membrane then vibrates the ossicles. The ossicles conduct the vibrations across the middle ear to the oval window, and then the oval window initiates vibrations in the fluid that fills the cochlea. And then in the cochlea, that fluid vibration strikes the hair cells, and the hair cells then stimulate nerve endings. And then the nerve endings will send impulses to the brain via the cochlear portion of the vestibulocochlear nerve. There's a really good video I'm going to find for you guys that illustrate how we hear using sound, and I'm going to link it in the comments because it's just really well done, and I personally really like it. So hearing loss can be divided into two main categories, conductive and sensory neural. The conductive hearing loss is caused by a disease or a malformation of the outer or the middle ear, and with this type of loss, all sound is weaker and muffled because it is not conducted correctly to the inner ear. So it's the problem with the sound waves traveling all the way, from the outer to the middle, almost, to the inner ear. But then once you go into the inner ear, we have sensory neural hearing loss. It's caused by damage or malformation of the cochlea or of the cochlear nerve. With this type of loss, some sounds are distorted and heard incorrectly because the nerve impulse is incorrect. And that wraps up our anatomy physiology review of the ears.